So I'm talking about fever in babies, and this is part one because there's a lot to say about fever. So a rectal temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius is what we consider a fever. The rectal temperature is the gold standard. So that is what we would ask for if we wanted to help assess a baby with a fever and what to do. We would prefer for the parent to give us a rectal temperature. So how do we approach a fever in an infant? Infant meaning a baby between from birth to 1 year of age. So from birth to 28 days, if a baby has a fever, that is an absolute emergency. It does not matter what's going on. You have to call and go to the emergency room. We do not want you to give Tylenol. And at this age, their immune system is not well developed. And so the risk for serious bacterial infection is there. So the next age group is 1 to 3 months of age, needs to be seen like the same day. The risk of serious bacterial infection is lower than in the first month of life, but it is still there. So we would prefer for you to go ahead and take baby in, or at least call and discuss what's happening. From age 3 to 12 months, it depends on how the baby is acting. It really depends on how the baby looks and as to whether we're really worried or not. There is a risk of serious bacterial infection, but it is much lower than for the younger age groups. And especially if a baby is up to date with shots, it is even lower. So most fevers come from common viral illnesses in this age group that can be managed at home. Once you've been in contact with your doctor and the doctor agrees that, hey, this is something that you can manage at home. So when do you, let's see, call if the fever is 104 degrees Fahrenheit or 40 degrees Celsius or higher. So if you're at home with this age group, this is when you call 104 degrees Fahrenheit or higher. Call if the fever is lasting more than 24 hours and there is not an obvious cause for the fever, like runny nose, coughing, and so forth. Call if the fever is lasting more than 2 to 3 days. And also call if your baby seems more sick than just a little bit sick. So Dr. Charlene Blache, board certified pediatrician, I hope that these tips about fever were helpful. We'll do fever part 2 in the next video for infants. Take care.